Hello, everyone. Thank you for joining us today. Today's Cancer Care Virtual Seminar topic is Exercising as a Cancer Survivor. My name is Annie Gebbe. I'm an Outreach Coordinator for the Samaritan Cancer Resource Center, and today I will be your host and moderator. This event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Joining us today is Joann Markham from Samaritan SamFit. Thank you for being with us, Joann. We really appreciate it. We're all excited to hear what you have to say. So when you're ready, the floor is yours.
Hi, I'm Joann Markham. I am a health and fitness specialist with SamFit. I have been working with cancer survivors for a number of years. I've actually been a certified personal trainer since 2007. And working with the Cancer Resource Center probably for the last 6 or 7 years. So kind of created a nice little PowerPoint about exercise. And so most of my studying I do for cancer survivors is through the American College of Sports Medicine and also the American Cancer Society. So go ahead and hit next. We'll go to our next slide. So there's a lot of reasons all of us say that we shouldn't exercise. And they're true for cancer survivors as well. A lot of times you feel like you don't have enough time or enough energy to do exercise. You don't have a gym membership. You don't have any home equipment. You don't want to exercise during treatment. And sometimes you feel that it's not necessary. So they have found exercise is really important. And bottom line, what the American Cancer Society says is they just want you to move. They just move, whether it's going to the kitchen and doing laps around the kitchen table, whatever, it's just getting up and moving with it. Go ahead and hit next. So exercise can be beneficial. So not may, it can be beneficial. So some of the reasons how it can be beneficial is by our next slide. So it can reduce the risk of osteopenia and osteoporosis. So some of the treatments that you go through will actually kind of increase your risk for osteopenia and osteoporosis. So they have found all forms of exercise do help with osteopenia and osteoporosis. So it's usually a weight-bearing exercise, but they have now found that strength training also works that because there is a blood supply that goes to our bones. And so technically, when we're using our muscles and our bones, we have two different things that happen with our bones. So we have like the osteoblast, so that breaks our bones down. And then we have the osteoclast, which actually builds our bones back up, so it makes the bones stronger. And that is with weight-bearing, cardio, or strength training. Next. So improving mood, it can help with depression and anxiety. So with COVID, a lot of us have the depression and anxiety with it. What happens when we exercise is there's a hormone released, and it is endorphins. It's our feel-good hormone. So it will help boost the mood with it and kind of helps with the depression that can come with feeling like you're not able to exercise, or the whole ordeal of going through cancer and the cancer treatment. And exercise helps you feel a little bit better about yourself. So a lot of times it can help with the anxiety that can come with this as well. Next. Reducing symptoms of fatigue, and it can lessen your nausea. So again, kind of that exercise, it's that feel-good hormone, but they found that exercise will actually increase your energy. So give you more energy to do things. So sometimes it's just hard just getting up. So doing the exercise can actually get you up and do a little bit more with your life. And it does help with the nausea. So it kind of gets all the blood going and helps with your hormone levels as well. Next. It improves balance and physical abilities. So again, with some of the treatments for cancer, especially with chemotherapy, it can introduce neuropathy, which is that tingling, that numbness in the extremities, usually in the hands and the feet. If it's in the feet, this can affect your balance because you can't feel your foot placement or how it's working. So doing different exercises, getting the muscles strengthened in the lower limbs and stuff can help you with your balance with it. Balance is one thing that we need to work on all the time. It's one of those, if we don't use it, we lose it, but we can actually gain it back. It helps with your physical abilities. So exercising helps with the heart. It's going to help build muscle mass, which is going to help you do things more efficiently and help you live more functionally. Next. Improving quality of life. So bottom line, the reason all of us should exercise is it's going to improve our quality of life. That's making our daily life easier to live and stuff like that. So lessening the pain, making the movements easier, not having fatigue as much. So we should all, whether we're cancer survivors or not, have exercise in our life to improve our quality of life. Next. Maintaining and preventing muscle wasting. So it's that lovely old adage, if you don't use it, you lose it. So if you're not using that muscle mass, it will start to waste away. So we want to kind of prevent that. So doing strength training is going to kind of help maintain our muscle mass. You may still lose some just because of some of the treatments, but doing nothing, you're going to lose a lot more. So the more you exercise and build those muscles, even before surgery, can help with your recovery after surgery and such. Next. Reducing the risk of heart disease and diabetes with the secondary cancers and stuff like that. So unfortunately, being a cancer survivor, you are at an increased risk for heart disease, diabetes, and secondary cancer happening. So they have found doing cardio, it's going to help work that heart, it's going to make your heart stronger. If you're not exercising, dieting right, then you can acquire type 2 diabetes, and then secondary cancers, a lot of times you're at a higher risk for that as well. Next. Precautions. So I'm sure all of you have watched those DVDs or YouTubes that they say, always please contact your physician before entering any exercise program. So as a cancer survivor, there are some precautions that we need to be aware of. Next. So always check with your doctors. So I put doctors in plural, so that's your primary physician as well as your oncologist. So check with them before you begin an exercise program, making sure that you are exercising with it. They will give you precautions. There might be certain exercise or movements that you shouldn't do. Next. Be mindful of any recent surgeries that might limit your movements. So one is if you have a port. So if you have a port put in or a port taken out, they recommend that you don't do any exercise for a week after either it being put in or taken out on the chest area. You don't want it, that has to heal, and you don't want infection to cause. Again, if you've had a recent surgery, you're going to want to kind of let it heal before you do some of your exercises. Next. Don't exercise if you have a low blood cell count. So just being mindful of that, it's going to kind of affect your energy level. So you don't want to exercise if you're super, tired. You don't want to be lifting super heavy weights because you might actually injure yourself when you're doing that. So just being kind of mindful of where your blood count is. Next. So don't exercise if you have symptoms that cause you concerns. Listen to your body. Your body will speak to you. And we're not listening to the part that's asking us for Krispy Kremes or ice cream. We're listening to see if there's pain or something just doesn't feel right when you're exercising. Next. If that does happen, please call your doctor immediately. If you're all of a sudden feeling fatigued, if something just doesn't feel right, contact your physician. They will get you in, do some tests and see what's going on, because there might be something that needs attention right away. There are actually guidelines for exercising, and this is from the 2016 Department of Health and Human Services. So these are the guidelines for all Americans. Next. Cardio. So everybody hears about cardio. Cardio actually needs to be done about 5 to 7 days a week. So you want to try and hit like 2.5 to 5 hours of moderate intensity workout. So moderate is basically doing gentle walking, treadmill, out for the walk, out for a hike that's not very hilly, easy bike riding, or 75 minutes to 2.5 hours of vigorous. So this is more intense. So walking at a quicker pace, walking uphill, riding your bike uphill, riding it in the wind, dancing, doing cardio dance, other things like that. You can have the equivalent of doing both. So it's not all or nothing or one or the other. You can actually do both. What are some ways to get cardio in our life? So a lot of times people think, oh, I need to go to the gym, I need to be on the treadmill, I need to be on the elliptical. You can go for hikes, you can go for walks, you can go to your local high school or community college if they have a track, walk around the track. You can go dancing. Dancing is a great way to get the cardio in. Ways at home, vacuuming, doing your vacuuming, yes, housework can actually be cardio. Doing it for 10 minutes at a vigorous pace will actually increase your heart rate. Going outside, if you have a push lawnmower, that's also another way to get cardio in our life. Next. Balance. So unfortunately, if we don't keep on working on our balance, we're going to lose it and it's going to diminish. Not having good balance is the #1 reason people have falls when they get older. So we want to make sure that we're doing our balance. So balance is something we can do daily. It can be doing something for stability. So as we're doing balance, we want to try and hold it for between up to 30 seconds, if not more. There's different ways that we can do balance. So balance, standing on one foot's the good old traditional one. If you need to, hang on to something for stability. It kind of just gives you a little bit more reassurance, excuse me. And just having something there for a safety net's good. You can do the heel to toe walk. And that is basically the sobriety test. Excuse me, I'm grabbing a drink of water real quick. And that is placing one foot in front of the other foot. Usually have people starting down, looking down at their feet, and then as you get stronger with it, you can look up, you could even go backwards. Lots of different ways to get balance into our life. Next. Strength training. So strength training is recommended doing at least 2 days a week. If you can get 3 days, it's good. Moderate or greater intensity, and you want to hit all the major muscle groups. So the major muscle groups are our upper body, so front and back, so chest and back, shoulders, and lower body is the legs, and then doing our core as well. So what are some ways to get strength training? Traditional, coming into the gym, lifting the weights, dumbbells, using weight machines, but there's other ways that strength training falls into our life. So going outside, doing gardening, pulling on those weeds is actually strength training. You can use your body weight, so you don't have to go to the gym. You can actually do stuff at home with your own body weight. So different ways to get it. The definition of strength training is moving your body against a resistance. So just finding that resistance. So dumbbells, resistant bands, machines, gyms, lots of different ways. Next. Stretching. Bet you've asked how many times people stretch. I will say I'm not a good stretcher either. But stretching is something we want to do. So stretching, we always want to make sure we're doing it when our muscles are warm, not when they're cold. So when we do a stretch, we're trying to reach it to the point of discomfort. So when you feel that slight little pull, then you kind of want to back off a little bit. You never want to stretch to the point of pain. When we stretch, we also don't want to do what's called ballistic stretching, which is the bouncing stretch. You want to go to that range of motion, hold it for up to 30 seconds, and then release. You also want to make sure you're breathing while you're doing your stretches. Don't hold your breath with it. Lots of different ways we can do stretching. Next. So we can stretch daily. So good classes for stretching are yoga. It's a wonderful way to kind of get that range of motion in. You can do, excuse me, Pilates is a little bit more core, but it also does some stretching. Just range of motion exercises. There's lots of different stretches out on the web that you can do. Again, do what you're able to do. Sorry guys, allergies have kicked in. Another drink of water. Okay, next. Next slide. And that is it. So if you do need to contact me, I do have different exercises that I have created for cancer survivors. Feel free to shoot me an email and will give you some answers. I'm here at the Albany Fred Meyers, sorry, that's where I used to work, Albany SamFit, Monday through Wednesday. I'm in Lebanon every other week and Newport every other week. So thank you for allowing me to talk with you guys, and let me know if you have any questions.
Thank you, Joann. All right, so please go ahead and use that questions or chat function to put in any questions or comments for us. While we give you a few minutes to do that, I'm going to move ahead to a couple of slides with some important information on them. If you'd like to obtain any more resources or information about cancer, please feel free to contact the Cancer Resource Center, and we can be reached a variety of ways. You can call us, email us, visit our social media or website. I did want to mention on here that the Cancer Resource Center and SamFit offer a program called Survivor Fit, which offers 3 free months of access to the gym as well as personal training if you're a cancer survivor. So please reach out to us if you're interested in visiting Joann or any of our other wonderful people at SamFit. I am a member myself and it's great and I highly recommend it. Let's see here. Upcoming events, we've got a full schedule in July, so please join us again for the events we have listed here. We have orthopedic oncology, skin cancer prevention, and Dr. Shirley from the Samaritan Breast Center joining us for decoding your mammogram. You can sign up for these events like you did for this one. Please visit our website or join our newsletter. Give us a call or come on into the Resource Center. Someone asked, are there any exercise programs specifically for cancer survivors? I'm going to step in with that one and just reiterate that Survivor Fit is our 3-month free program for cancer survivors to go to any of our SamFit or partnering locations. And there is a bit of free personal training involved with that as well. Joann, I was wondering if you could maybe tell us a little bit about exercising together.
So Exercising Together is a program that I did this last year with the research department. It was actually originated by OHSU up in Portland for cancer survivors and their partners. Kind of a way to get exercise back into their life and also kind of help with that communication. So we were able to do that this last year. We got a grant and we were doing it virtually with it. So we actually supply the equipment for you guys to utilize, and I am the one that leads the exercise for that. So we are currently planning for our next one. So this is some good news. This year it actually now has become a program with the Cancer Resource Center. So we're hoping to start that back up again in September. So if you're interested, reach out to the Cancer Resource Center and we'll get some information about that. So great way. We've supplied benches, dumbbells, lots of different exercises, and everybody that's taken the class really loves it.
Great, thank you. I wasn't sure of the date of that resuming, so September it is. We'll be sure to include that in our newsletter as well as on our social media. So anyone interested, feel free to keep an eye out or reach out to us regarding that. I'm not seeing any other questions at this time. I did want to mention that if you have questions that come to mind at a later date, feel free to email us at Cancer Resource Center cancerresourcecenter@samhealth.org, and we'll be sure to forward those to Joann to help us answer, and we'll get back to you on an individual basis. And finally, you will be seeing a survey pop up at the end of the presentation, as well as in your email. If you could please fill it out for us, we really appreciate any feedback you have or any ideas on other topics you'd like to hear about. Please fill that out for us, and thank you very much. Joann, thank you for being here. We really appreciate you taking the time out of your day. It's wonderful to have you, and we're looking forward to seeing you again soon.
All right, thank you for having me.
Yeah, no problem. Thank you, everyone. You may now disconnect, and please fill out our survey. Have a great day.